Hey everyone, it's Dr. Dave. Hopefully you're all doing well, taking care of each other, doing your best in our current circumstances to stay healthy and well. And for some of you, that means still taking care of your neck and back pain. And we send out a lot of valuable information by email, but I wanted to cover one of the things that's special and unique to chiropractic when it comes to getting treatment with us or any other chiropractic clinic. And that's for checking for parts of your body that aren't sitting or moving right, and then helping them sit or move better. All the tests we do, all the checks we do are kind of to determine if there are some parts that aren't sitting or moving properly, because chiropractic's really good at getting them sitting and moving better. And we do that very specifically. So sometimes you might have a series of parts, like in your spine, for example, but sometimes it could also be a knee, a hip, low back, or pelvis. Also, it could be the other way, or it could be a shoulder, elbow, wrist, and hand sequence. It doesn't really matter. What we do is we check for how well those things are sitting and moving. And if everything is sitting and moving well, when we go to do stuff, every part will participate. So right now you can see the white sections and the red sections all bending. But what we check for when you come is to determine whether or not there are some sections that aren't participating. So right now you might see that those red sections aren't participating. So when we do a chiropractic treatment, a specific manipulation, not just the mobilization, not just to get things moving and freed up, but a very specific, some part is not sitting and moving, it's not going this way on this angle in this part. That's the specificity involved with chiropractic. So when that part is not participating, we can get it to participate again by doing a treatment. So your assessment will involve finding those parts. Your treatment over time will help to release those parts, and when we release them, when we get them sitting and moving better, they typically feel better, which is ultimately what you're looking for. Now, in this challenging time, you may not be getting those adjustments, and we don't want these areas of dysfunction, joint or segmental dysfunction, to build up again. So hopefully you remember to do some of your range of motion, or what I call your yoga for cheaters. There's a video that I'm going to put out, if I didn't already, depending on the sequencing, on remembering how to use the wobble chair. But at home you can do it on a Swiss ball or even on the edge of your bed. And then of course we've sent you some specific exercises by email. If you're an existing or past patient, you should have received those. And hopefully you're doing some of them, because what they help to do between the visits is they maintain the movement in those parts as much as possible. But right now, with the frequency of your care maybe decreasing for a while, your self-care should increase so that you maintain the functionality in those parts and keep them sitting and moving well. All right? So check out for those videos. They may already be up. If not, they're going to be coming your way. If you want to, get a hold of me and I'll gladly either resend you some of those exercises you have on file here at the clinic with your treatment. And if you're somebody who's just stumbled across our site and you're suffering with some neck pain and back pain, you don't know what to do, where to go, and how to get that treated right now, please reach out. We'll be happy to speak with you and maybe give you some suggestions before we can see you in person. We're happy to make sure that this time that you're spending with family or in self-isolation or, heaven forbid, quarantine, that is productive and you can work on some of your health and wellness. All right? So until I see you next time, take care of each other, stay well, and we'll talk soon.